God. Well, like I said, for Christine and Cindy, if the health professions don't work out for you, you should really try open mic at your comedy club. Okay, you too, Andrea. You guys are funny. I'll go. I would go see her. Do you have a routine yet, Christine, Andrea, Cindy?
I got a couple jokes.
What?
Yeah,
You got a couple jokes?
Yeah, in case this nursing thing don't work out, I got a couple jokes.
Okay, well you have a razor sharp sense of humor, and that's always a good thing through life, to be sure. Cindy's not here, and of course we have Andrea. Anyway, okay, it looks like we got the usual suspects. I sound like Barney.
Yes, every time I hear you, I'm like, you sound like Barney from the Flintstones.
What's even funnier is how the hell do you know who Barney is from the Flintstones? How do you even know the Flintstones? Oh my God.
They have an older movie out, like the real life version. I don't remember what his name was. Is it Barney? I thought his name was Barney.
You have Fred Flintstone and Barney Rubble. Yo, Fred. Christina, you watched them as a kid. How old are you, Christina? I didn't think they were still on the air in the last 30 years. Okay, maybe. Yeah, I said last 30 years, so you might did. All right. So we're off to a great start on the. You guys are the craziest class I've had in a long time. I think it would have been way even crazier if we actually were face to face. Well, there was a Flintstones movie, that's for sure. But yeah, and if you have HBO Max, they actually have all the old original Flintstones on there. And yes, I occasionally watch them just for some nostalgia, because yeah, those have been around for 50 years. Boomerang, yeah. Okay, so looks like we got a pretty full house. And yay, Cindy finally shows up. Hey, Cindy. Okay. All right, wonderful. So, what's on our agenda for tonight? Any questions? Could I record? Ooh, yeah, I guess I can record. Oh, and then she puts a please in there, and then another please. How many pleases do I get? Okay. As long as everybody does. Okay, fine. I get it. Hi, Jennifer. How you doing? How's your 9% phone charging? Oh. Yeah, Jennifer is at the car inspection thing, and she said, sorry, Professor, I'm at 9%, so we'll see how long she lasts. Okay, I will record. Oh, goodness gracious. Remember, this is a group effort, team effort. So I'll record it. It's being recorded. Oh my gosh, a question. Professor. Yep. No, Jennifer was being a very conscientious student that texted me right before class and said, hey, I'm almost out of battery here. I'm like, oh, okay, that's cool. That's a conscient. I assure you, in your futures, folks, I assure you, if you establish a relationship with your faculty and professors in your health professions programs and let them know that you're conscientious and dedicated and motivated, it will take you far. Oh my God. And you get away with a lot more stuff. Trust me. All right. So first question, I have a question over the acid-base. All right. Shoot, Christine. What do you got?
So I know you only said there was only a little bit of this on the exam. I only highlighted the bicarbonate buffer system and then hydrogen ions and then the electrolyte balance. But that's all I had, so I just wanted to make sure I had everything.
Yeah, I'm not going to ask you any questions about the electrolyte balance. We've been doing that all semester. You know how aldosterone reabsorbs sodium. You know how PTH works, parathyroid hormone, and calcitonin works with calcium. That's it. Okay, that's it. So that's nothing. All right. So do not worry about that. Okay, Andrea, you're crazier than I thought you were. So yeah, that'll be a nice little. Yeah. Okay. It's a lot of corn. That's going to go, yep, the poop will be interesting. Yep. There's going to be a lot of stuff in there. That's good for the system. Again, that flows right through. All right. Okay. So, Christine, really, that last lecture before the reproductive stuff, I just want you to know that the big one is the response to acidosis. That is by far. I'm not going to ask you anything about electrolytes. I will ask you, well, we'll wait till we do our team thing on what's really important. Okay. Andrea, that's great, but that was on the last exam of the corn. But now you know when you see that corn, you can, well, no, you can't. 2-year-old maybe, but again, you know, like, oh, I don't know if you have a he or she or what, but if you see a lot of corn in there, it's like you just say, hey, you need to chew better. Yes, very good. Cellulose, you need to chew better. Okay, and then we had Tolani. Could you please go through composition of body fluids? I don't even know what you mean by that, Tolani. What do you mean composition of body fluids? That's not even going to be on the test, all right? If you guys were paying attention, a lot of that stuff was just for your edification, for your knowledge, but I don't have any questions about composition of body fluids, all right? In fact, who can impress me for a gold star? What's the only thing I want you to know about fluid balance? Really? Crickets? Oh my goodness gracious. Oh, no. When we were discussing fluid and electrolyte balance, what's the only thing I wanted you to remember about fluids? Come on, somebody. Oh. All right, and fluid intake. You guys are disappointing me. Okay, Natalia, that is a true story, but that's not what I emphasized. What did I emphasize? For the love of God. Thank you, Christine. Thank you. Come on, folks. All right. So don't worry about, I'm not going to ask you anything about electrolytes because you should know that. You should know by now that sodium is higher outside, potassium is higher inside, calcium is higher outside. Yeah. Not a big deal. Give me another question, a real question of profound significance. You guys kill me. Okay, Andy. Genesis. Those slides are extremely confusing. Can you go through the process one more time? Okay, I can do that. There are a couple questions about that on the test. Let me pull the slide up. I don't want to try to draw that. So just hang on 2 seconds here. All right, so you have to understand, of course, as a hardcore biologist, we look at this through an evolutionary lens, meaning that in evolution, especially for the female, the mother, it's all about energy of conservation, because if she eventually does produce, she's primarily responsible. All right, so let's go to that slide. And again, this is probably like 3 points worth on your exam. So let's go through that one more time. Because, yeah, it is a little confusing. It is a little confusing. All right, so boom, boom, boom. Give me 1 second here to pull that slide up. Okay. All right. Okay, one more time. And I want you females to know this, because this is all about you. I mean, most of this class is, I don't even know if do I have any males in this class? Is it just, we got Joshua. Yeah, we got Josh. Okay. And Daniel. All right, Josh and Daniel. All right, that's the typical ratio. All right, so now you're going to be way smart, Josh and Daniel, on the female reproductive system. So, okay, so, and again, I want to keep this simple. All right, so what I want you to get out of this, Andy, is, okay, you were born with how many eggs? Ladies, how many eggs were you born with in your ovaries? Okay, thank you, Christina. All right. Clever answer, Bucola. Thousands. All right, so about 300,000. All right, beautiful. Okay, way more than you'll ever need. All right, and a lot of those will die eventually, you know. And that's something, you know, we had a fun lecture on the reproductive system, but that's the other little 2 cents I want to put in there. So you have all the eggs you ever were going to have when you were born. And so that is the threat, and this is a public service announcement, is a threat if you decide to have kids when you're 60 years old. Why? Why? That's not rhetorical. Yes, you have 60-year-old eggs. All right, and so yeah, it's just exposure. I mean, you carrying the same eggs around for 60 years, and you got what? You got carcinogens, you got radiation, you got chemicals. So yeah, it's just a little bit risky. No, a lot risky, to be honest with you. Okay. All right, so going back to this here, what I want you to get at is, okay, so when you hit puberty, all right, all your eggs in primordial, they stopped in prophase 1. That's all I want you to get out of this. All right. Prophase 1 is the very first step in meiosis. And we're saying that we're not going to waste any energy on going through the whole damn thing, whole darn thing. All right. We're in prophase 1. Significant events happen in prophase 1. For 5 gold stars, who knows what happens in prophase 1 that is profound for reproductive life? Something extraordinarily significant. The what's? No. And again, no. I'm talking about for just
the DNA copies.
It's already copied. It's something that makes. Okay, Vanessa. Vanessa just got 5 gold stars. Congratulations. Everybody give Vanessa a shout out. All right. Crossing over is when those genes get together and switch parts. So crossing over happens in prophase 1. So yay for Vanessa. She's now my star student. Because that's what makes us all different. Because in prophase 1, those chromosomes swap parts so that we're all different, which is very profound in reproductive anatomy, because again, that makes sure that we're not all clones. So so good job, Vanessa, crossing over, swapping pieces of our genes so that we don't all our brothers and sisters don't look exactly alike. All right, wonderful. So that's not on the test, other than the fact that all your cells, this is on the test, all your cells are stopped in prophase 1 when you're a child before puberty, in the primordial follicle. All right, and then boom, we hit puberty. And then, once again, a handful of those primordial follicles will develop into primary, secondary, tertiary vesicular follicles. We'll complete our first phase of meiosis when one of those follicles ovulates. So when it ovulates, it will finish all of meiosis 1, prophase, anaphase, telophase 1, and then it'll go prophase 2, metaphase 2, and stop. So this is the 2 things for everybody that I want you to know, all right? So you stop in prophase 1 as a primordial follicle prior to puberty, and we just sit, and then you go into puberty, and then you have your ovarian cycle, and then every month you get that one special, or maybe 2, follicles that ovulate, and then that cell will finish meiosis 1 all the way to metaphase 2 and stop. That's it. And as we talked about, it will go no further unless it gets fertilized. It will go no further than when it gets fertilized. All right. And again, the whole, in a very simplistic nutshell, that's like for the female that is worried about energy, is like, why go through all these processes if I'm not going to have a fertilized egg? Does everybody get that? Andy, are you okay? All right. So unlike males, it's just like, I just watched, and I'm not going to get too crazy, but I just watched a Monty Python special. Has anybody ever seen the movie The Meaning of Life? Am I too old for you guys? The Meaning of Life from Monty Python? silence. Wow, nothing. Nope. All right, put that on your list. If you want to see an insane movie. Does anybody here actually know who Monty Python is? Well, Christine, of course you did. Of course you saw the Holy Grail. Good for you. All right. Andy, you've never heard it? Andy, you're like 30-something, and you've never heard of Monty Python? Oh, my goodness. Cindy, I don't even know how old are you, Cindy? Okay, you have an excuse. Andy does not, all right? Like 13. All right. Anyway, I don't know if this is, it's all right. Remember, this is comedy. You should watch a little bit of Monty Python. They are genius British comedians that had their skit shows for years. I can't believe you've never heard of the Monty Python show. And they made 3 major movies. And Holy Grail is one. The Life of Brian is the second one. And The Meaning of Life is the third one. But they are irreverent. They're irreverent in the sense that they will oh my gosh, they will just crucify anything and everything. And so, yeah. Where am I going with that? Well, there's a song that they sing. It's a Catholic church, and they're singing a song about every sperm is precious. Google it after a class. Monty Python, every sperm is precious. And the point is, no, they're not. All right. We make billions of them. But every ovum is precious. That was my whole point. Okay. So women go through this process. When it come up, you're going to say, first of all, you have to put Monty Python, and then you're going to put every sperm is special, and it's going to play a song that's in the movie, The Meaning of Life. All right. And it's a very Catholic thingy. Like I said, it's just totally irreverent. All right. It's funny if you have that kind of sense of humor. And it sounds like several of you do. What else, Christina? All right. So, okay. So Andy wants to know what's going to be on the other 97% of the tests. Well, that's for you guys to figure out. So shall we go about it? Let's start from the beginning. No, let's not do that. Let's do this. Oh my God, come on, guys. Let's start with, tell me what you know is going to be on the exam. All right. I have said numerous times what is really important. So that's where we're going with this. All right. I'm not going to, you want the last, 5 lectures? Oh my God. Okay. All right. Okay. You guys are like overwhelming me here. All right. So stop for a second so everybody can digest this. So yes. So let's everybody get their pens and pencils out and mark this. All right. So, for crying out loud. Hold on. Let me. Sorry about that. Just another person wanting to buy my house. Okay, so. All right, so. Everybody got their pen and pencil out? Here we go. So there are some really good ones. So flow of urine out of the kidneys. So yeah, you should start and be able to tell me starting at the DCT, the collecting ducts, the minor and major calyces, the renal pelvis, ureter, bladder, urethra. Easy breezy. So that's one good one. Beautiful. So we got that done. And now the next one is, let me get rid of this here. I'm looking at your thing. GFR, which we, again, remember what I'm going to do. I'm going to give you stroke volume, heart rate. You're going to calculate cardiac output, and I'm going to give you what percent is going to the kidneys, and then what percent of that is plasma, and what fraction is going to be filtrate. What are you not going to do? What did Very good, Christine. Remember, that's the gotcha for everybody, is don't use the hematocrit. You're going to subtract whatever hematocrit I give you minus 100. And you're not going to remember the numbers that I have on the lab, on the PowerPoint. I'm going to change them. Okay, good. All right, so we got 2. Check off 2. All right, what's next? Pretty close. I think my numbers add up. But like I said, if you get a number between 100 and 140, you're probably okay. Yeah, exactly. Exactly. All right. As long as you don't get something like 200, then you know you did something wrong. And what did you most likely do wrong? You put hematocrit versus subtract from minus 100. Okay, we're done with that one. What else, guys? Come on. I think somebody said it earlier. I may have missed it. Hold on. Blood flow through the kidney. Very good, Natalia. So blood flow through the kidney, starting at the renal artery, all the way through. Beautiful, beautiful. Okay. Okay. Oh. RAS will definitely be on there again. Renin-angioaldosterone system. Again, honey, I cannot emphasize how important that's going to be in your futures. All right. You have to know that system. Christine, what do you mean by the T? Oh, yeah, transport maximum graph. Just the key one. The TM, the transport maximum graph, which is, I'm assuming that's what Christine is referring to. You just need to know at what blood glucose level am I going to max my TM out? And what would that be? What's the blood glucose level? That's the max. Anyone? Beautiful. All right, Christine, let other people play. All right. Both you and Christina, let other people play. All right. And so 300, that's your blood glucose level in your blood. That was kind of right there. And what's my transport maximum? Anyone besides Christine and Christina? Seriously? Oh my God, Bucola, you're in the kidneys. Think milliosmoles. No. Thank you, Joshua. 375. So that'll definitely be on the test. All right. Okay. All right. Beautiful. So yes, know that one graph because you're going to get, oh gosh, did I? Oh no, I did not. Okay. All right. Here's a good time. Does everybody have their lab handout for the urinalysis? We're down to crunch time here. All right. if you have it, please pull it up. All right. And I'm going to go to it right now because those questions are hard according to my students. So let's go through this. Thank you for reminding me. Otherwise, you guys would have really been in bad shape. All right. All right. Okay, hang on here. Boom, 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 boom. All right. Here we are. This is your analysis lab. And again, it's like I said, that's why I'm not a big fan of fully online classes, because this is a cool lab to do. In fact, I'm teaching a hybrid, and where they do the lecture online, but we go actually into the lab, which apparently none of you really wanted to do. But we do a urinalysis, and we actually check your urine for things that should and should not be in there. And I won't mention any names, but we had a young lady that had way too many white blood cells and blood in her urine. So what does that mean? What does that mean? Yep. So, yeah, so that was cool. So she was like, okay, fine, I will go see the doc because, yeah. So, yeah, it's a urinalysis lab. Let me get down to what would be testable. All right, so give me 1 second as I'm working through here. So, yeah, so this urine lab you do in class, it's really simple. You pee in a cup, and you stick an assay strip that has a bunch of different things in it. Everything that you see right here, I'm on abnormal urinary constituents. All right. Hopefully, we all know that you shouldn't have any glucose in there. That probably means that's indicative of diabetes. We shouldn't have any proteins, maybe just a tiny bit of the small ones. All right. Ketones means that you are on a ketone diet, or you're starving, or you have diabetes. Never should you have blood. All right. And never should you have leukocytes unless you have an UTI. So like today was cool. It's a very small class. I only have 7 students in my other class because it's actually in the classroom. And when her strip came up, oh my goodness, you have a very strong leukocyte present and a very strong blood present. Yeah, they're nowhere near as funny as you guys are, that's for sure. But like I said, they actually get to see what their urine assay looks like, and so everybody else looked normal except for one that had a lot of white blood cells and a lot of blood. So I'm like, you need to go talk to your doc and get on antibiotics. So there'll be a couple questions about this, what should not be in your bloodstream. Well, that's just it. That's why I love in the class thing. She's like, well, I have had this pain in my back. I'm like, yeah, that's your bladder. Go see somebody. Exactly. But whatever. Yeah, she's like, I had this pain right where my kidneys are. I'm like, that's not. Hopefully it's not your kidneys. Hopefully it's just your bladder. But yeah. Anyway. Yeah, it's back pain. Exactly. It's back pain. And, yeah, exactly. See, this is, oh my gosh, beautiful, beautiful guys. But yeah, she's like, well, I've had this back on my pain. I'm like, oh, no, that's not really an indication, believe it or not, Christina. It's not the hurt to the pee. That's a guy thing with a STD. because this is happening in your bladder or further up your ureters or your kidneys. So, it hurts when I pee. That's usually a STD. All right. It could very well be a constant sensation of potty. Nice clinical words there. And we could use polyuria. But anyway, so yeah. So that's the beauty of actually being in the lab, because you get to see some cool things like that. All right, so let's get back to this thing here. So there'll be a couple questions on what should and should not be in your urine. So you need to review this stuff right here. Nitrites also mean that you have bacteria being busy, all right, as well. Okay. And then there's no questions about the color or turbidity and all that stuff. I'm not going to ask you anything about that. And then this particular page 5 looks kind of scary, but it's not. All right, it's what we did when we did the GFR thing. All right, it gives you the renal fraction, renal blood. So we already talked about that, and blood flow and filtration. We already did all that here. Now, the renal clearance thing that we kind of blew off quite a bit in the lecture boils down to these questions right here. All right. So let's do this together. All right. So read the first question, and yes, I will. All right. So again, I will give you this right here, filtered load. Filtered load means just how much of the stuff that you filter. All right. So it's your GFR, how much filtrate that you produce, and we're talking about a particular substance. And in this case, the substance is going to be glucose. So I'm going to go to my camera now, and we're going to do the math, because there's one question on that that's worth quite a few points. So pay attention. So here we go. All right. Boom, 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 boom. All right, here we go. Everybody should have pen and pencil, or pen and paper, and doing this with me. All right, so on this question, it says my GFR is equal to 135, which is a little high, but that's okay. Okay. Per minute. And here's where you have to be careful. And I have my plasma glucose at 300. What should first stick out real quick? What should stick it out? This is my plasma glucose or blood glucose level. What's wrong with this number, folks? It's too high. Come on. It should never be above 180. We've gone through this already. All right. So that's pretty high. All right. So that says, what's the filtered load? How much glucose is in the filtrate? That's what filtered load means. Load. And so it's just GFR times the concentration. But what's wrong with me multiplying these two numbers? Why can't I do that as such? Christine. Very good, Christine and Andy. Yeah, I'm not sure why you put the UG in there. Christine. You can't multiply a deciliter and a milliliter, so you got to convert. So what's the equivalent of, yes, I know you hate math. Everybody hates math. All right, so that's why we learned the metric system. So we have to convert this deciliter into milliliter so that we can multiply. So how do we do that? So it's going to be 135 milliliters per minute times what? To give me milligrams per milliliter. Okay, Christina, very good. And I just lost a bunch of people. Again, remember that's your, that's your simple conversion of deciliter to milliliter. All right, and that's 100. So you divide 100 by 330. Okay, very good. All right. So now you can multiply. So everybody multiply and tell me what you get. Are you sure about that, Christina? Is anybody going to back her up? You have no friends, Christina. All right, Andy says fine. All right. Okay, that's what I want. I want you guys to help Christina. Just don't leave her out there hanging when I challenge her. So 452.25. All right, so that's how much. All right, so that's how much glucose she has in the filtrate. Now, what's the max I can yeah, you and Christine need to let everybody else give a one shot because you guys are definitely right on top of this. Yeah, Deani's like, yeah, keep going, keep going. I want everybody to play. All right. Not too much. You can throw your wise jokes in there. All right. So this is how much glucose is in the filtrate. How much can we maximally reabsorb other than Christina or Christine? What's our max reabsorption? No, that's what your level is in your blood glucose. Okay, good, Cindy, Bucola, Joshua. Yeah, 375 is the max that we can reabsorb. That's my TM max. All right. So this is what's in the blood. This is what's the best I can do. So what's the difference? Oh, that's clever, Cindy. Not much. That's really, really clever. All right. I don't know how Joshua and Christina, is that what you came up with? Everybody is coming up with 77.25. Okay. Yeah, but something's not right here. What did we do wrong? Oh, okay. Fine, that's fine. I screwed up. What did I screw up on this question? Go back. Where did I screw up? It doesn't really matter, but where did I screw up? In the very beginning of this thing here, pre your thing. What did I mess up in the very beginning here? That's yes, Cindy. I should have used what? Per the question. No. Very good, Christine. I should have used 355. That's why the numbers didn't seem right to me, but that's okay. That's perfectly okay. Why what? On your question, it had 355, and for some stupid reason, I put 335. Yeah. So for some reason, I put 335. My bad. That's okay. It's still, this all still works out because on your test, I'm going to use different numbers. All right. Yeah. Okay. But like I said, when all you guys came up with 70, so it would be 452.25, which didn't sound right, but I didn't register, minus 375, and I get 77.25. That's what could not be reabsorbed. Jennifer. Yeah, okay, Christine, but we're past that. We're going to go with my numbers. So this is the point, and it's actually a very important point. So this is the max I can reabsorb. This is what was in the filtrate. So what happens to this glucose? Christina, it can't be reabsorbed. This is our maximum reabsorption. Okay, Natalia, it's in the urine. All right. Joshua, we're better than waste. All right. This is the glucose that's going to be found in your urine. All right. That's fine. That's fine. All right. So yeah, this person's probably diabetic because this is way over 300. And we have glucose in the urine. This is how much. All right. Beautiful. Beautiful. So it's kind of good that I did this one because I'm not, like I said, I'm going to give you a question like this, but it's not going to have the same numbers. Very good, Christine. It's the flowing honey, diabetes mellitus. And Christine, do you remember how 200 years ago they determined if you had diabetes? Sweet urine. Yum, yum. You guys are crazy. All right, yeah. So I'm going to give you a very similar one, but I'm not going to use the numbers that are on the handout. So it might be something similar to using 335 or another number. But so you have to know just the absolute basic math, and that is, multiplying the GFR times the concentration, make sure your units are right, come up with this one, subtract it from 375, and then tell me how much glucose is excreted. Beautiful. All right, let's move on, shall we? Any questions with that? And it's recorded, so you can go back and look at it again. All right. So here we are. Okay, the next question is one of those critical thinking outside the box, confidence in what you know. So let's look at two real quick. So I have somebody that has a plasma glucose of 100 milligrams per deciliter. That seems reasonable. And their GFR is 125. That's very reasonable. But, oh my gosh, they have glucose in the urine, 1 milligram per milliliter. So if you calculate the filtered load like we did, you'd have 100, or actually, this is deciliters, so you'd have 1 milligram per milliliter times GFR, which is 125. So you'd have 125 as your filtered load. But I still have glucose in my urine. And your hint to the follow-on question is, what is the normal range for blood glucose concentration? And you're all going to chime in and tell me what? Hey, Katie's here. Katie, how long have you been here?
The entire time, Rick.
Oh, well, I'm sorry. I don't look at the roster. I'm looking at the comments.
Hi. What's up, my nerd?
Oh, I got a pretty full class. Okay, so what's the normal range? All right, so in this question, it says that this individual has a blood glucose or plasma glucose of 100. Is this person a diabetic? Again, this is just thought-provoking. I have glucose in the urine, but my plasma glucose is fine. Is this person a diabetic? And Andrea says a definitive no. All right, beautiful. So this is the kind of question you would have in graduate school. So you should feel like, ooh, cool. All right, so because it says right there, a hypothesis. All right, so okay, they're not diabetic. They're not diabetic, but they got glucose in their bloodstream or your urine. And then, of course, I ultimately put a hint in here because no one was getting where I was going with this. So what's wrong? Somebody. Again, it's hypothetical. In graduate school, as long as you can provide some basis for your hypothesis, it's always a correct answer. What's wrong? What could possibly be wrong? My glucose levels are fine, but I got glucose in my urine. This could be answered. This could be answered in like words. Andrea, go for it. Oh gosh. No. But that's to think about it. The glucose levels are fine. All right. So this isn't nothing about how much glucose you consumed, because your blood glucose level is fine. All right. Okay. Be more specific, as Alex Trebek would say. Okay, those are too generic, folks. You can't just say kidney problem. Again, based on the hint. Oh, okay, so Cindy just changes it from kidney to renal. All right, that's pretty clever. All right, look at the hint. This answer could be done in like 5 words. No one? Come on. Okay. Natalia just said the glucose levels are just fine. All right. There's nothing. They didn't eat too much sweets because their blood glucose is 100 milligrams per deciliter. That's fine. That's right where it's supposed to be. You're not getting my little hint. No one gets the. Thank you, Andrea. That's pretty good. I wanted you to simply say, well, somewhere along the co-transport system, it's broke. All right. Remember, and maybe you haven't studied that far along, we'll use a co-transport system to get glucose back in. So we have the sodium potassium pump, and then we have a co-transporter that draws glucose back in. And somewhere that's broke. All right. And what's interesting about that is because we have several drugs on the market for diabetes that intentionally do that. They break the co-transport system to reabsorb glucose, so patients with diabetes don't reabsorb all that glucose. They literally say, just get rid of it, we're going to flush it out. So we have drugs that break the co-transport system, so we get rid of a lot of glucose in patients. And it would work, although they obviously say no, it's not for that. But this would work if you wanted to lose weight. If you took this particular drug and then ate whatever sprinkled cupcakes or whatever you wanted, you would lose weight because you're just peeing away all the glucose. Everybody get that? All right. And last but not least, the rest of this is exactly what you know is going to be on there. I'm going to give you your hematocrit. I'm going to give you your heart rate, your stroke volume. You're going to calculate cardiac output. I'm going to give you renal fraction, renal blood flow. You're going to get from the hematocrit. What are you going to do when I give you hematocrit, everyone? All right. Okay. Don't forget, people. And that's it. And then here are some basic questions. These are just good for you to know. All right. So do a little bit of homework, but not a lot. All right. And starvation, somebody tell me, if I'm in starvation, what am I going to see in my urine? No. Ketones. Very good, Chris. Ketones, yeah. Urinary tract infection, which we just covered. Leukocytes in blood. Very good. All right. Transfusion would be blood as well, or hemoglobin. All right. Hypertension, you're going to pop, and this is the only one. I'm not going to ask you on this test. This is just you. If you have high blood pressure, hypertension, you're probably going to find more proteins in there because the pressure is going to be enough to push the proteins out. Yes, very good. Very good, Christina. All right. And the last one is not going to be on your test. It's just you whiz. There's a thing called diabetes insipidus. Insipid means not real, tricky, sneaky, not the same thing. A lot of interpretations of what insipid means. But diabetes insipidus is basically the disease when you are, how did Andy say it? A lot of potty. Is that how you did that, Andy? A lot of potty breaks? Okay. So yeah, you can tell when somebody's had kids when they use the word potty. All right. It is if you have kids, potty. So polyuria is the fancy term, but potty is much more efficient. All right. So diabetes mellitus. Mellitus refers to honey, Talani. So that is diabetes, the one we've been talking about. All right. Diabetes insipidus means it looks like diabetes, but it's not. Because one of the main symptoms of diabetes is you potty a lot, as Andy would say, or you pee a lot. All right. But it has nothing to do with diabetes mellitus. For 10 gold stars, I'm really throwing it out there. I've never given 10 gold stars. What would make you think of your kidneys and everything you've learned? What would make you produce a lot of urine that was unnecessary? And I'll give you a hint. It has to do with a hormone that you're not making. 10 gold stars. A hormone that you're not producing that makes you pee a lot. Wow, Vanessa, you've been racking up the gold stars. I mean, you got 15 in one day, I believe. Exactly. So yeah, there are genetic things where folks don't produce the ADH. And so, yeah, so they're not retaining any of the water because we know we need ADH. So yeah, that's what diabetes insipidus is, just the lack of ADH. So congratulations to Vanessa and all her gold stars. All right, let's get back to the rest of the test because we have a long way to go. Okay, so where were we so far on my list? I'm writing them down so I keep track. Hopefully you guys are keeping track on what we've covered as far as what's going to be on the test, right? All right, so real quick, I have the flow of urine, GFR, blood flow through the kidney, the renin-angiotensin-aldosterone system. We have the TM max for glucose, 375. Of course they do, Vanessa. Of course they do. Of course. All right. All right, guys. Lots more stuff that we need to be covering. Come on. Other questions on the test? What do we have? Okay, very good, Christina. All right, now, Christina, you are now done. All right. I'm not going to have Christina fill.
Oh man, should I just leave then?
No, I may need you at a later date. All right. So stop.
Because I can go take a nap right now.
No. I think you provide a little bit of inspiration for everybody else. All right. Or intimidation, one of the two. I'm not sure. All right. So, yes, the purpose of the countercurrent. And remember, just those 3 bullets. All right. Good. All right. Yes, Diani, buffer systems, the basics. Again, let me emphasize that one more time. You're going to talk about the buffer systems, i.e. what's a buffer system, and you're going to talk about what's going on during metabolic or acidosis in general. All right? Okay. Everybody got that? So again, the buffer thing is part of the big question of acidosis involving the kidneys, the lungs, and the buffer systems. That's where that comes into play. And how a buffer system works. All right. Okay. Good. All right. And remember, not only the RAS, what's the other important system besides the RAS? We've already mentioned it like a dozen times. Very good, Natalia. Very good. All right. So yeah, the ADH hypothalamus link. All right. We're doing good. All right. Here's a quick question. What if I do have 300 milligrams per deciliter of glucose in my bloodstream and I'm not diabetic? What could be the other cause? I never really emphasized that. Very good, Christine. Christine, I don't even quite get where that comes from. I don't know. But yeah, you ate too many cupcakes. You ate all your Halloween candy in one night. All right. So yeah, you can overload by just eating a whole ton. Like, for instance, if you did that glucose tolerance test and you drank 3 of those bottles, you would definitely have glucose in your urine. All right. Beautiful. Christine, you want to elaborate on the mosquitoes?
I mean, is it
Yeah.
true that mosquitoes like bite you because you have sweet blood, or is that just something that they say?
No, that's not a thing. There's actually a very unique thing about that. Katie can probably tell you that. Katie, do you remember what are CO2? Oh, I said the answer.
No, I think it's CO2 emissions that attract mosquitoes.
Yes.
that what you
Yeah,
heard?
yeah. I kind of blurred
You
that out.
blurted it
Believe
out.
it or not,
Good job.
no, I kind of sort of blurted it out, but I don't think anybody heard me. But yeah, CO2. So if your skin is exuding CO2, mosquitoes like CO2. So it has nothing about glucose. Mosquitoes don't give a damn about your glucose levels. But for some bizarre reason, yeah. Yeah, I'd like to think that I've taught you enough in this class that you were lied to quite a bit, all right, in life. So yeah, there's some studies that say that some produce more CO2 than others, and this mosquitoes are attracted to CO2. Yeah, exactly. All right, beautiful. Okay, let's move on here. So we know how a buffer system works. All right, here's a big one. All right, so 1 gold star to each. You only get to do 1 source of acid per student. So I need 3 students to give me the 3 sources of acid. Okay, everybody stop and go slow down. Slow down. You're going too fast, too many answers all at once. All right. Yeah, and that's called sarcasm. All right. No, not urea. That's not even an acid. The 3 sources of acid. Okay, Bucola, you always give general answers. All right, Bucola. Andy, that's, I'm looking for the specific. Cindy, I don't even, oh my God. We didn't even talk about DHA. All right, Bucola, carbonic acid. Very good. All right, so we got that one. Okay, somebody's already said, but fat metabolism gives me what? Okay, Joshua got the second one, lactic acid. Thank you, Christine. I thought we zippered you. Oh my God. All right, but yeah, that's fine. But yeah, some of you had fat metabolism, but that wasn't good enough. Fat metabolism gives me the ketone bodies that Christine just announced. Okay. Phosphoric acid is one, but it's not that big of a deal. It's nowhere near as important as lactic or ketone bodies or carbonic acid. But on the test, I would give credit for phosphoric acid. Okay, good. All right. Hey, we haven't even talked about sex. So let's talk about sex, baby. God, you know how old that song is? Let's talk about sex, baby. That song is like 30 years old now. Do you realize that? Who sang that? Was that? Oh, Salt and Pepper? Deanne knows that one. Let's talk about sex, baby. Just like you. Who sang that? Come on, somebody. I want to say Salt and Pepper, but I may be wrong. I don't know. It's very old. All right. It was Salt and Pepper. Okay. All right. All right. So yeah, I'm not quite losing it. All right. Okay. So here we go. Yeah. So sperm flow from the testes to ejaculation. Excellent, Vanessa. So write that down, everybody. So you're going to go from the seminiferous tubules, from the epididymis to the ductus deferens, into the seminal vesicle, converging with the ejaculatory duct, through the prostate, prostate gland, seminal vesicle, and then the bulbourethra, and out the urethra. Bam, done. See how easy that question was? Beautiful. All right. And I'm just going to give you these guys. What's the role of the dartos incremaster muscle in one word? Per our crazy discussion. All right. Shrinkage. Very good, Christina. All right. Shrinkage. Very good, Christina, and Diana. Again, remember, you're going to say thermal regulation. All right. The shrinkage is just the Seinfeld episode that we discussed. All right. And then, of course, you're going to tell me the basics of spermatogenesis, from spermatogonia to primary spermatocyte to secondary and spermatids. All right. And then the hard stuff is for the female side of the house, right? So you have to tell me everything about estrogen. All right. What does estrogen do? Who can impress me? Give me 2 functions of estrogen besides your secondary sex characteristics. Come on, ladies. There's 14 of you in this class. What does estrogen do for you? Actually, yeah. Really, just FSH? And why is Daniel answering this question? Yeah. When? When does estrogen inhibit LH and FSH? All right. I know. The 2 guys answered the estrogen question. That's really, that's really, oh my gosh. Shame, shame, shame. Okay, you're unzippered now, Christine. All right, because we're now talking about the female reproductive system, and it seems like Joshua and Daniel are taking the lead. Exactly, Daniel. You should know this stuff. So yeah, so it's certainly in the ovarian cycle. Again, that's a very, very vague answer. But if you remember the one slide, there's a point where estrogen inhibits FSH and LH when the follicle is developing to shut down the hypothalamus. Remember that? Remember that one side that has the numbers and the cycles and circles? Look at that one. So, and then that's at low levels, and at high levels, what does it do? Low levels inhibit FSH and LH. What do high levels do? Really? All right. The surge of LH. Very good. Which causes what, Christina? Very good, Andy. Andy rolls in there. And I'm going to give you a gold star for that one. All right. Ovulation. Beautiful. And of course, estrogen also makes your endometrium happy. All right. No estrogen, it has a fit. And then what happens when your corpus luteum dies? Ladies, Daniel and Joshua, do not answer this. Okay, period. All right. All right, beautiful. All right. See? Cool. I'd like to think that now when you do your destruction, violent destruction, violent destruction. All right. Hostile. Okay, wonderful. So like I said, Yanni, tears. So So yeah, ladies. So the next time you have your period or your menses, I want you to think about what you learn and think about all those spiral arterioles having a fit and contracting and dilating and contracting and just ripping and tearing your endometrial lining off. All right. Isn't that a pleasant thought? Okay. Yeah. Oh, you guys are hilarious. No, that was perfect. That's fine. I'm sure it feels like that. Well, okay. Sexy time during menses. Oh, okay. Yeah, that happens. Oh, Christine wants to know the graph. Again, there's not, if we were in class, I don't know that, Joshua. I really don't know that. I'll have to consult my doctor friends about menstruation and asthma.
No, I only ask
I'm
because
sure
my wife always experiences shortness of breath prior
Yeah.
to menstruation. So just wondered
Oh,
about
yeah. Well, well, again, you have tremendous steroidal changes with the estrogen, progesterone, and like I said, there's so many things we don't know. In fact, how many of you mamas out there, if that's okay to say, had gestational diabetes? No one's had gestational diabetes? It's one thing. Andy's crazy. Oh, so you guys didn't. All right. Well, again, there's a thing where women that are pregnant get a kind of diabetes. It's very temporary, and again, I just bring that up because we really don't know why that's going on. It obviously has to do with your steroid levels, but we don't. There's some things we don't know. So, can menses cause shortness? It possibly could. Who knows? All right. All right. So we've got the estrogen thing down. All right. Make sure you can tell me all about the role of FSH and LH in the ovarian cycle. That one slide. There are several questions on that one slide, and everybody knows what slide I'm talking about, right? The one I walked you through that has the 1, 2, 3, 4, 5, 6 and around. All right. Okay. And what does that mean, Deani? 42 to 45. I'm not sure what you're referring to. Okay. All right. Again, don't worry about those ones that look like a schematic. All right. We don't care about the schematic. Just the one that's really nice and very convenient that has the arrows and the numbers. All right. All right. So don't worry. The first couple slides, I'm like, oh God, they took all the fun out of the ovarian cycle. All right. Beautiful. And then, of course, you're going to describe the role of the corpus luteum, right? What's the corpus luteum's role? Seriously? Why? Andrea, not good enough. Not good enough. Be more specific. Okay. Can we do better than that? Okay, Andrea, very good. Very good. So Andrea is good. If pregnancy does not occur, the corpus luteum dies, and then again your endometrium has a fit. If you are pregnant, remember the production of HCG, human chorionic gonadotropin, is going to keep the corpus luteum going for the next 3 months to preserve the endometrium. All right. Until, as Deanna just said, the placenta takes over. Beautiful. All right. So, guys, if you were paying attention, you got everything on this test. All right. Everything that you need to know. That's it. I just literally covered every freaking question on this test. Yeah. So if you've been paying attention, taking notes, and you can go review this again, you should ace this test. Of course, metrics are on this test, always. Did I go over the kidney what? What's CO?
It was the cardiac output, like the 20 to 25%.
Come on, Christine. That's part of your GFR question.
Well, I
How
didn't
much-
know. It was on a different slide, so I just wanted to make sure.
Yeah. So one of your big GFR questions is determine what cardiac output and what percent goes to the kidneys. And then what percent of that blood that goes to the kidneys is plasma. That's part of the GFR big bonus question. Okay. Right. And metrics are on there. Metrics are going to be a little sneaky because it's not just basic conversions. They're going to be things where you're going to have to actually apply it. All right. What? It's not sneaky. It's just I want you to actually use it. So how about if I give you the first question? The first one as a freebie, because everybody showed up today. All right. Here we go. The very first question. So you're not shocked and stunned and crumble for the rest of the test. Okay. Here we go. Listen to me carefully. And maybe as we sign off, let's see if we can do it together. So everybody gets at least 1 point on this test. All right. So everybody ready? Got pencil and paper ready? We have a 154-pound patient who needs morphine at a dose of 0.002 grams per kilogram of body weight. How much morphine do you give them in milligrams? This is like a so you get the Katie the Do I need to repeat that to anybody? Oh, crying out loud. All right, I'll talk slower. You have a 154-pound patient who needs morphine at a dose of 0.0002 grams per kilogram of body weight. How much are you going to give them? See, and Christine is just going to help you out, guys. Yeah, it's math. So Vanessa comes up with 0.013 milligrams. Well, that doesn't sound like a whole. That sounds like I'd still be in a lot of pain. Vanessa, we don't give morphine in grams. That's just cute. Look at Christina go. I'm going to give you a couple minutes. See if you can get close to where Christina is. Anybody else? Anybody else? So we've got 0.014. Again, folks, remember we have to get to milligrams. I asked you, and that's important. Okay. Remember on this test, remember what I asked you for. All right. So some of you would have gotten it in grams, but I didn't ask for grams. I asked for milligrams on this question. Of course, you don't get to see the question. I just said it was there. But very good, Vanessa. Vanessa nailed it at 13.9, but I would have taken 14. Okay, wait. Do I need to do this for you? $70. I'm not. Oh. Hold on, you can't just throw a number out there. So Joshua says 14 milligrams. Vanessa says 13.9. Oh my goodness. Oh goodness gracious. All right. Shall we do it together? All right. Real quick. All right. Okay, so the first thing we have to do is do what? We have a 154 pound person. We need to convert that into kilograms. So we get what? Help me. All right, I get 70. All right, and you know, I will take a little bit of rounding off. So 70 is good. So I got a 70 kilogram person here.
Professor, can you scoot your board down a little bit? Yes, sir. Thank
Okay,
you.
sorry about that. Yeah. Okay. There we go. All right, and then they need how much? Come on, help me here. I'm not just going to spoon feed you. 0.00. And you know what's really important, folks, in physics, chemistry, biology, math, is to put that 0 in front. So we know. So we need 0.002 milligrams per kilogram. Is that correct? All righty. Okay, so what's the first step? The first step. We got 70 kilograms here. So what do we do? Andrea just blew past the whole thing. I'm trying to show everybody. Mhm. And get what? 0.014, but is in what? I multiplied 70 kilos by kilos, right? Did I lose everybody there? Are we good? What's missing? Andy is lost. Who else is lost? Okay, so Katie, are you here? Or did she leave? She left us. I multiplied 70 kilograms times this per kilograms. All right. Does everybody see what that is? So what I'm saying is this is, so this is kilograms. All right. Okay, the 5,000. No, all I have to do this is 0.04 kilograms. What is this in milligrams? Mm-hmm, mm-hmm, mm-hmm. Cindy, that was all right. Okay. How many grams is this? 0.014 kilograms is how many grams? Christina, how did you come up with 14? Christina, or was that just this? And there you have it, Christina. There you have it. All right. All right. Well, guess what? That's probably the hardest question on the test. And so just so the best case scenario, just memorize Christina. Answer is 14. All right. Oh, goodness gracious. So I'm afraid we could do, I just don't want to confuse you anymore if you're not sharp on this. All right. All right. So again, the kilograms cancel out. You can't cancel them out. You're not dividing, multiplying. All right. But yeah, Christina got it right. You know, you have the 0.014 times 1,000 to get rid of the kilograms. Does everybody see what she did? 0.014. That is in milligrams, but we want per kilogram, so we need to times it by 1,000 to get rid of that kilogram thing. And so we multiply that by 1,000, we get the 14. That just probably blew everybody out of the water. Well, I just gave you the freaking answer. All right. So you don't need, yeah. So if all that just blew through you, oh God, then you just memorize 14 for your very first question that comes up. All right.
Why are you doing this to us? Why can't you just make our last exam like easy, like something small?
I just gave you every single question on the exam. The metrics, oh my God. There you go. So yeah, so you can just write a little note saying question number 1, don't know what the hell just happened. The answer is 14 milligrams, and then you're good. Okay. All right. Okay. So yeah, but like I said, so this answer is milligrams per kilogram. All right, and I want to get rid of this. So all I do is multiply 0.014 times 1,000. Now I've got rid of the kilograms, and there you go. All right. So, okay. You want one more? That's the hardest one by far. Oh, God. What do you dream about, Andy? Do you dream about your future profession? Your aspirations, your motivations?
Yes, sir.
Or are they just nightmares about metrics?
No, I have a dream that that this class is going to propel me to med school, and that I'm going to do great things, but it's going to be all because of this class. So you're part of it. You're part
That
of
is the
dream.
best answer. All right. Yeah.
But that's only if I get
That
an
was really sweet.
A. So I have to get an A.
Yeah. All right. Okay. Well, I'll grade your test easier than everybody else.
Thank you.
Not, but no, but thank you. Thank you. There's nothing that a professor or a teacher loves more than when a student gets to where they want to be and they send an email saying, hey, I'm now a doctor, I'm a PA, I'm a physical therapist, I'm a nurse. Thank you, because everything I taught you, you are going to see again. In fact, just a cute, real quick story. I had a student that was going to teach San Antonio to be a PA, and she was taking a class, And as soon as the instructor said sodium potassium pump, she said, all I could think of was Fofi. So that made me feel good. All right. Yes, I want all you to succeed, you know. Thank you, Christine. Yeah. And I'll be honest, since we're in the awe moment, the professors that had a huge impact that got me where I am today, I will never forget them. They are ingrained in my brain. I can name off 6 biology and chemistry professors that really changed my life. And sadly, most of them have passed away because I'm old, but they will always be in my life because they changed me. All right. Yeah, yes, Christina, do the online evals. All right. That doesn't really help me. I don't really blah, but I'm always up for giving literature, but also not to like, but what do students look for in an instructor online? Where do they go?
Rate my professor.
Yeah, rate my professor. So if you want to, but be honest, you know, you can say, well, his tests suck. You can say that. I'm fine with that. You can say his tests suck, but they're fair. Okay. But the rate my professor doesn't help me. Good gosh, I don't care. You know, I'm the department chair. But it will help other students to give them an idea of what they are in for. Yeah, I have good reviews, but and Andy, that's and I'm perfectly fine with that review. All right. My tests suck, but I don't. Okay, I'm good with that. But it'll make you a better student in your future endeavors. Okay. All right. No, I'm not an emo. Does test make you drink? Yes, as it should. All right. So we'll do one more. So everybody will at least get a score of 2 on their first exam. Fair? All right, here we go. Because yeah, the last test is challenging you. All right, so this is the second hardest question. The rest of them are not that hard. Okay, so pay attention. I'll talk slowly. And everything is significant in what I say. To make you a better person, Cindy. To make you a better person. My hardest professors were the ones that I remember the most. I was like, dang. One more. To every little word. Here we go. Are you ready? 2 hours after meal. 2 hours after a meal. Your patient has a blood glucose level of 2.4 grams per liter. One more time. 2 hours after a meal, your patient has a blood glucose level of 2.4 grams per liter. Convert this to milligrams per deciliter. And is this person normal, diabetic, or what? This is nowhere near as hard as the last question. Okay, one more time. 2 hours after a meal, your patient has a BGL, blood glucose level, of 2.4 grams per liter. grams per liter, convert that to milligrams per deciliter. Based on these results, is this person diabetic or normal? Very good, Andy. Very good. So your conclusion is? Did you not hear the second part of this? Okay, good. Yeah. Yeah, remember, after 2 hours, it should not be that. Cindy, you're just throwing stuff out there. What in the world is that all about, ketoacidosis? What has that got to do with anything? Exactly. That's why I say you have to read the questions clearly, all right? So they ate, and then 2 hours later, their blood glucose level was 240. Is that normal? No. Yes, Natalia, you can have a gold star, all right? It should never be over 180. I mean, it wouldn't be 180 ever in a normal meal. We can push your glucose levels to 180 if we gave you pure glucose in a little solution like we did on the glucose tolerance test. But a normal meal, it should never get above 180. It just, there's no way, because again, you're not drinking or eating pure glucose. You're eating a potato that needs a lot of time to break down. And so it should never get that high, ever. Okay, so did everybody get that? Everybody get that? All right. Okay, so those are the two hardest questions on the test, and so on the, not on the test, but on the metric system. But yeah. So yeah, the good point is there's not as many metric questions. Let's do one more, shall we? Let's do one more. It's just a conversion question, but like I said, I like to use real world things. All right, so here we go. So this is question 3. Are we ready? During the ovarian cycle, hey, you guys are typing when you should be listening. All right, here we go. During the ovarian cycle, estrogen blood levels can rise to 16.0 nanograms per deciliter. Convert this to micrograms per liter. One more time. During the ovarian cycle, estrogen serum levels or blood levels can rise to 16.0 nanograms per deciliter. Convert this to micrograms per liter. All right. Cindy, where in the world did you go? Seriously? Cindy, what have I always said if you have a bunch of zeros in there? All right. Remember, the metric conversions should never have a bunch of extra zeros in there. So yes, congratulations to Deani, Vanessa, Andrea, Joshua, Christina. 0.6 was the right answer. So now look, you can confidently walk into the test knowing you have 3 points. All right, folks. Any questions about anything? They don't pay me enough to do that. You have everything at your fingertips. You should all get A's on this test. Andy, what does that mean? We're scheduled until 9:30. I'm not sure what that even means.
That means we have.
This is the.
That means we have.
I will
plenty of
say
time
this.
to do more.
I will say this. Andy, I'm sorry. You're kind of. I didn't quite hear what you said. Are you talking to your kids? Okay. Anyway, so what am I going to do without you guys? Well, you know what? I will say, with all honesty, without a doubt, that since COVID, for the last 2.5 years, this has been the most fun class I've ever had. You guys are amazing. You're fun. And like I said, God, the first 2 years online was like, my God, I'm just yelling at a screen. No one's saying anything. I will send out an email if I ever get COVID. I've already given you guys lots of extra credit. You guys do realize I've curved every one of your tests, right? Oh, and we're gonna no, Vanessa. We are. That's been consistent. So here we go. So test 3 should be ready. I just haven't posted because I haven't decided, Vanessa, on what curve I'm going to get. When your test is delayed, I'm like, how much should I curve? You know, and of course, some of you know you kind of like make it difficult because you do so well, and I'm like, you know, I'm not going to give a curve where somebody in this class gets 108 on their test. All right. Yes, I've calculated all the gold stars, but every test has had a curve, some more than others, but I have to look at who did really, really well. So if somebody, yes, we've come a long way, Andy, and like I said, believe it or not, you guys don't know it, you don't see it, but the first curve was huge, and then I pared down on the curves ever since because it really wasn't necessary. And yes, participation means everything. That's where I'm when I grade, I'm like, yeah, I know what Christina was thinking, even though she didn't quite get it, but I know, you know. But yeah, that's just one of those subjective things that professors do. But the participation from, you know, over half of you has been remarkable, and it has made this class fun compared to, don't tell my other class, but my other class is like, oh my God, it just, no one says anything. They just don't say anything. But anyway, so, well, we'll see, Natalia. We'll see how you do. All right. And yes, Christine, I think we should. After Monday, our last day, I think the next Friday or Saturday, I think we should go out to a nice, you know, bar, tavern, and yeah, I would like to see you guys in person. All right, because like I said, some of you are hilarious. You know, you're just hilarious, but I forget what you look like. Oh, Andy, aren't you clever, Andy? Yeah. Okay, so Christine, Andy wants you to bomb the next test to inflate the curve. All right.
Let Andy's wrist and now make it there.
God, don't you dare do that. Don't you dare do that, Christine. Okay. But like I said, next Friday or Saturday after the semester's over, yeah, Deani's like being strategic. And Christine, they want you to get an 80, hoping that everybody else gets a 20-point curve. You nuts. So yeah, but I'm serious. Like maybe next Friday or Saturday, we can meet somewhere in the central Austin. You know, because I'm south. I'm sure some of you are north, and Some of you are God knows where. But let's do that. Who wants to be the party organizer? Andy? You're in Hutto. That's Christine is south. Christine is probably closer to how far south are you, Christine?
I just moved to Buda.
Okay, so we got Buda on the south end. We got Andrea in Hutto. So we need to meet in the middle. No, Vanessa, I'm too old to go to 6th Street. All right, I will stick out like a sore thumb. Georgetown for Andy. We'll meet somewhere. Here's what I'd like to meet. Because this is my local hangout. My office is at Rio Grande campus. Everybody familiar with Rio Grande campus? Okay, so there's a bar. Pay attention. By my office, there you go. So there's a nice tavern that serves food and wine and drink called the Tavern. And it's on the intersection, right on the intersection of 12th and Lamar. And it's literally 1 block from my office at Rio Grande. So let's do that. I'd like to see as many of you as possible. I don't care if it's Friday or Saturday. Which day is better for everybody, Friday or Saturday? All right. So it looks like Sat is it. So Andy, I'm going to make you the party organizer. And so you will set up. Yeah, it looks like Saturday's good. So Andy will be the party to send out an email. So let's do Saturday at the tavern. I don't know. Pick a time, Andy. 7 o'clock. And then we will celebrate Deani's birthday Monday early. This is Saturday. Saturday at 7, we will celebrate Deani's birthday. How old are you going to be, Deani? The big 22? Oh my God. All right. All right. Okay. Beautiful. All right. Okay. So that sounds like a date. So Saturday, next Saturday, and I'm thinking 7, but 7 plus or minus is good. I would love to see all of you in person because, like I said, you all have such amazing personalities. This has been a fun class, to be sure. All right. Okay, so when is the test available? Yes. Next Saturday. Saturday through Monday. So the test will be available at 10 o'clock Saturday until Monday night. Yeah. All right. So Andy will reinforce or emphasize that we're looking at next Saturday at the tavern at 7. All right. And you guys can communicate. And again, test Saturday 10 a.m. to Monday midnight. Be ready. You have everything you need to get an A on this test. Everything. I gave you all the questions. All right. So work it. Have a good night, folks. Love you all. I just said that, Kalani. Yes. Saturday till Monday. Good night. And somebody remind me to post this lecture we just did. Agreed, Andrea. You guys have been a great class.